Ivan.
And today we're going to be talking about an intraoral and extraoral examination and the importance of the examination. So we want to do that examination to make sure that the outside and the inside of the face and mouth is in normal condition, and it's important for you guys to understand what is normal and what could be abnormal.
And early detection of oral cancer is very essential to curing it.
As soon as the patient walks into the operatory, we greet them and we assess their response, gait, and appearance. We review their medical and dental history and take their vital signs. We begin the extraoral examination. We observe the posture, gait, and their voice. By doing that, we're assessing their responsiveness and attitude. We start assessing the face region. We look for symmetry, jaw movement, signs of cancerous injuries, and we look for any signs of twitching or paralysis that could be caused by a cancerous lesion or disease. We assess the pupil and the color of the white portion of the eye. We palpate all different muscles in the head, face, and neck region. We expect no pain and no irregular growth on the muscles. You can see here there's a birthmark. It is important to ask the patient if it has grown in size and shape over the years. We ask the patient to open and close their jaw, and we assess if there's any noises coming from the jaw or any lesions that are preventing the jaw from opening all the way. Moving on to the thyroid gland. We hold the cartilage and we ask the patient to swallow. Cancerous lesions may cause difficulty in the movement of the cartilage or swallowing, which will prevent it from moving smoothly. Lymph nodes are important structures when trying to detect oral cancer. We palpate and massage the lymph nodes in front and behind the ears, in the back of the head, below the jaw and the chin, and to feel the outermost neck lymph nodes, we must ask the patient to turn their head the opposite way, and then to feel the deeper ones, we have to ask the patient to turn towards the palpation side. We also feel the collarbone lymph nodes. Healthy patients will usually have lymph nodes that are not palpable, meaning we cannot feel them. Diseases and cancers will make the nodes hard or swollen. Moving on to the lips, we check the color, texture, size, blisters, ulcers, and lesions. We use 2 fingers to feel the lips. Healthy lips should be smooth, lubricated, and soft. Outgrowth, hardness, or bumps must be observed. The tongue is one of the most important intraoral structures when identifying oral cancer. We check for shape, symmetry, color, texture, coating, any lesions whether they're raised up or flat. We feel the top surface of the tongue, and we take a wet gauze and check the sides of the tongue for any abnormal growth. The sides of the tongue are the number 1 most common location for oral cancer to occur inside the mouth. Any lesions on the sides of the tongue must be brought to the attention of the dentist on the floor. And here are some pictures of oral cancer on the side of the tongue. Now we check the gums. We expect smoothness and a good amount of saliva to provide lubrication. We check the deep holes, the muscle attachments, and the cheek. As we're observing here, there is some melanin pigmentation, which is passed on genetically, and it depends on the patient's ethnicity. We're observing for any cuts, patches, or lesions that may require a biopsy by an oral surgeon. And then we continue to check the hidden under the lip areas. The lower lip is another most common location for oral cancer to appear in the mouth. Lesions go unnoticed in this area because we cannot see them. And here are some pictures of oral cancer on the lower lip. This is a cancerous lesion in the lower lip that was caused by tobacco. It is important to know that tobacco is the #1 cause of oral cancer. The floor of the mouth is the last most common location for oral cancer in the mouth. When feeling the structures in this area, we expect a lot of saliva, smoothness, and an overall pink color appearance. We ask the patient to raise their tongue and make it hit the roof of their mouth to evaluate the muscle attachment underneath the tongue. Lastly, we assess the roof of the mouth, tonsils, and the throat. We feel around the roof of the mouth and we look for consistency in color, shape, and texture. We look at the tonsils and the throat by asking the patient to stick out their tongue and place the mirror on top of the tongue and ask the patient to say, ah. We look for trauma, lesions, swollen tonsils, and infected throat. Extraoral and intraoral examination must be thoroughly documented. If lesions are present, the dental hygienist must ask the dentist to check the lesion. If the dentist decides that it is concerning, we refer the patient to an oral surgeon, which they may require a biopsy to diagnose the lesion. We must stay in touch with an oral surgeon and the patient and ask for copies of results.